One thing I think it's really important is that the internet is full of bad information. And a lot of times it's well-intentioned information, but it's just inaccurate. When it comes to spine surgery, one of the things that I think is very important is the selection of your surgeon. So what I tell people is the number one thing that you should look for is a foundation of training in spine surgery. I specifically think you look for a fellowship trained spine surgeon, your chances of having a better outcome are improved. There are talented neurosurgeons, there are talented orthopedic surgeons, but that person should be fellowship trained. In the 80s, fellowships became a thing. Before that, there were no fellowships. And so it's important that you look at the pedigree of the training. Where did they train? And then most importantly, what do patients say? What do patients say about their outcomes, about the way they were treated, about the time that was spent, about the devotion to their success? I think those are some really important things that you need to look at and look for. I also see comments all the time about, well, why did you go to an orthopedic surgeon? You need to go to a neurosurgeon. And again, I think this is a myth that's been pervasive for a long time. Orthopedic surgeons actually created spine surgery fixation. Orthopedic surgeons are the surgeons of bony fixation. They are literally the mechanical engineers of the body. So anything related to the bone, bony architecture, structure, instability, fractures, all the things related to joints, bones, muscles, and soft tissues surrounding those structures are best understood by an orthopedic surgeon. Now, an orthopedic surgeon without a fellowship is probably not trained well enough to do spine surgery. And so that's where the fellowship comes in. A fellowship is an extra amount of training, either 1 or 2 years, focusing on a specific subspecialty. In the case of spine surgery, most fellowships happen either after 5 years of orthopedic surgery or after 6 years of neurosurgery. So make sure though that your doctor is fellowship trained. Picking between a neurosurgeon and an orthopedic surgeon should be based on what patients say about that person. Orthopedic surgeons are the ones who are probably more geared to fixing structural instability, alignment issues, scoliosis, fusions of the spine. When it comes to soft tissue surgeries, anything inside the spinal nerve sac, anything that involves the base of the brain, those things should be done by a neurosurgeon. But when it's outside of the nerve sac, when it's a structural issue, when it's a matter of the support of the soft tissues, the spine is crooked, the spine is unstable, even something like a disc herniation outside the nerve sac, compressing the nerve sac, a fellowship-trained orthopedic spine surgeon is more than well equipped to fix that problem. And they have a specialty in getting bones to heal together, which is the key and the purpose of a fusion. So you want to make sure that the person understands the principles of bony healing. If they don't, you'll see mistakes made like therapy immediately after a fusion, or plastic spacers being used instead of bone, or synthetic bone being used instead of real bone. And believe me, those things make a huge difference. You'll also see sometimes surgeons will do screws on one side of the spine instead of on both sides of the spine. And it's a faster way to obtain fixation, but it's definitely not a more reliable way to obtain a fusion. So remember that the fusion is done by the bone that's placed in the spine, not by the screws and the metal that's holding the spine together. That's a very important concept to understand.